Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're doing another Kahoot, and we're going to be going over test-taking strategies. Before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already, and be sure to check out my website. I've got lots of resources available. You can sign up for a one-on-one tutoring session, private tutoring session, private consultation. Maybe you want to pick my brain about something. You can sign up for a Next Generation NCLEX review part 1 and or part 2. I encourage you to sign up for both. So in part 1, I teach you how to think. I teach you what the test writers are looking for from you. And in part 2, we actually go over the types of questions that have been seen on NCLEX, what NCLEX is trying to draw out of you, important things to know. So part 2, we go over actual questions. In part 1, it's all about how you should be thinking, and I teach you those strategies. So be sure to check out my website. If you're a current nursing student, I've got something in store for you too. I have audio lessons available. So if you're really struggling in the nursing program, be sure to check out my audio lessons. Again, my website is nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms, such as TikTok, Instagram, Facebook, and right here on YouTube. My handle's the same everywhere, Nexus Nursing. All right, guys, without any further ado, let's get started. Test-taking strategies. This is tips and strategies. First question, select all that applies. Which answer choices should you stay away from if you're guessing? You have absolutely no idea what the answer should be. Which one should you not choose? Here are your choices. Answers that includes words or phrases such as must, only, never, always, possibly, sometimes. Which ones, if you had no idea what the answer was, you definitely would not choose that as a correct answer? Go ahead and choose, guys. The code to get in is 227-4554. Okay, this is interesting. Let's talk about this, all of them, guys. If you have no idea what the answer is, do not choose an answer that includes an all-inclusive word such as only, always, never. Stay away from those. Stay away from those unless the question is asking you which one's the wrong answer, okay? So you want to stay away from all-inclusives, but you also want to stay away from wishy-washy answers. What are wishy-washy answers? Answers like, oh, maybe, possibly, sometimes, NCLEX does not like that type of nurse. NCLEX doesn't like the nurse that is wishy-washy. NCLEX likes the nurse that knows what they're talking about. So stay away from all-inclusives and stay away from wishy-washy answers, okay? Don't do it. Select all that applies. Which words or phrases do not promote therapeutic communication? Here are the examples. Tell me about. Why did you? Let's discuss. You're smiling. What made you? Do you want to? Which phrases do not promote therapeutic communication? Which ones, as a nurse, should not be coming out of your mouth to a patient? Do you know? Okay, I see some fellow Haitians on the chat. Sac passe? Okay, let's talk about this because a lot of you guys got this wrong. So tell me about, that's wonderful. That is an open-ended question. That promotes therapeutic communication. That promotes a patient opening up and talking, because You're saying, tell me about XYZ, and you're allowing them to express themselves. That's wonderful. That doesn't block therapeutic communication, so we're not going to choose that. I'm very happy no one chose that as an answer. Next, why did you? That absolutely blocks therapeutic communication. The minute you ask a patient why, you're making them have to defend themselves. You're putting them against a corner and they're not going to want to talk. That blocks therapeutic communication. So we're not going to choose that. So that's why that's the answer. That's the answer because we're looking for phrases that do not promote therapeutic communication. Next, let's discuss. That's wonderful. I'm happy only 3 people chose that. When you say let's discuss, you're giving the patient an opportunity to talk about whatever it is that they're feeling, but it's not a closed-ended question, it's an open-ended question. So that promotes therapeutic communication. Remember, we're looking for things that block therapeutic communication. Next, you're smiling. 90 people chose that as an answer. Making an observation does not block therapeutic communication. It actually promotes therapeutic communication. A simple observation, you say to the patient, "You're smiling. Your clothes are ironed. You brush your hair." A simple observation is a form of therapeutic communication because you're letting them know that you observe something different, and then you close your mouth, you be quiet, and you allow them to express themselves. "Oh, yeah, I was feeling better this morning, so I decided to increase my hygiene." Okay, so you shouldn't have chosen that because, again, we're looking for words or phrases that do not promote therapeutic communication. And making an observation absolutely does promote therapeutic communication. Next, what made you? That blocks therapeutic communication. We do not want to say that to a patient. That's why you should have chosen it. The minute you say to a patient, "What made you?" First of all, you sound judgmental as you know what, HE double hockey sticks. And in nursing, we are never judgmental. And so when you say what made you, you're putting them, number one, in a position where they feel like they have to defend themselves. So they're really not going to want to express themselves. That's number one. And number two, you're giving that patient an easy out. Imagine you're on the psych ward and you say to a patient, "What made you do something like that?" And the first thing come out of their mouth, "Oh, the voices told me to do it." Now they're not even taking accountability for their action because you said what made you. Absolutely not. Don't ever say that. And then last, do you want to? That's a closed-ended question. Do you want, so the patient's starting to act up, you're trying to get them to de-escalate, and you, instead of saying, "Let's go take a walk," you say, "Do you want to take a walk?" All they have to do is say no, right? That blocks therapeutic communication. Remember, you want to ask open-ended questions. You want to ask questions where the patient can express themselves. The only time you want to ask closed-ended question is if there's an emergency and you have to do a quick assessment. You're rushing that patient to the operating room and you need to know, are you on metformin? Have you taken it within the past 24 to 48 hours? Have you had alcohol within the past 24 hours? Are you on anticoagulants? Are you diabetic? Things like that. You're going to ask a closed-ended question. Suicide. If you suspect that the patient is at risk for harming themselves or someone else, you ask them directly, "Are you having those thoughts?" And last, abuse. If you suspect that patient's being abused by someone, you ask them directly if someone's harming or injuring them. Other than that, you want to ask open-ended questions. So the 3 options that do not promote therapeutic communication, you never want to say to a patient is, "Why did you?" "What made you?" and "Do you want to?" Because that's a closed-ended question. Okay? True or false? You should never select an answer choice that you've never heard of or you're unfamiliar with. Is that true or false? You have absolutely no idea what the answer is. You have no clue. If you're in that situation, you should never pick something that you've never seen or heard of before. Is this true or false? Good. This is true. I don't know why you guys do this. I chuckle every time I see it, but as students, when you come across a question and you're looking at your answer choices and you have no idea what the answer should be, for some reason, so many of you guys go for the one answer that you've never seen for before in your life until that day you sat down and took that exam. Why would you do that? And I know you're thinking, "Oh, maybe the instructor was teaching about it when I was texting my friend, or maybe I wasn't paying attention." No, No, most likely your answer is going to be something that you've seen before, you've heard of before, because remember, you are only being tested on the most common diagnoses, medications, nursing interventions that we see in the real world. Because the whole point of all of this, of you getting your license, is to see if you're a safe nurse. Why are we going to give you a question on something that only 1 in 10 million people ever see, that you most likely never going to see in practice? That makes absolutely no sense. A test writer is not going to waste a test question on something that is rare. Okay, so if you have no idea what the answer is, your best luck is to choose something that looks familiar, you've seen or heard of it before. True or false? If you're unsure of an answer, choose something based on what you saw at clinicals or something you saw in the hospital. So if you look at a question and you have absolutely no idea what the answer is supposed to be, you're looking at your choices and you don't know, and you see something that you saw happen in the hospital or at clinicals or at work, choose that. Is that true or false? Wow. 15, more than half. You guys said true? Absolutely not. It's the opposite. Let me tell you something. Oh my gosh. Let me tell you something. 99% of the time, what you see happen in the hospital is wrong. And I hate to say this, but guys, I'm telling you the truth. And the reason for that is what you're seeing happening in the real world. We have concerns in the real world that you really don't have when you're taking a test. When you're taking a test, it's a perfect world. You don't have concerns such as money. In the real world, money's a big deal. It should be, but it is. So certain corners are going to be cut because of money. Resources, certain corners are going to be cut because of resources. Staffing, certain corners are going to be cut because of staffing. Time, who has enough time? Certain corners are going to be cut because of time. There's certain things that we have to consider when we're in practice in the real world that you don't, for testing purposes. So whenever you have no idea what the answer is, do not refer back to something you saw happen in the hospital or at clinicals, because usually it's the wrong answer. And let me tell you something, for test taking purposes, you will have an option of something that usually happens in the real world and the right answer. Go with the right answer. You don't know what the right answer is, say to yourself, which one is the safest answer? Which one keeps my patient alive? Which one keeps my patient out of danger? Okay, that is your correct answer. Matter of fact, I tell my students this all the time. When you're studying and you're reading your textbook or notes and you see something to make you laugh, because you've worked in the hospital before or you've done lots of clinicals, you've seen a lot, and you laugh because you're like, yeah, right. This doesn't happen in the real world. That same thing that you laughed at is going to be a test question somewhere someday. So whenever you see something that makes you laugh, take note of it, highlight it, or put a star next to it. Just keep that in mind. Next question. Another select all that applies. What are answer choices you should always stay away from, no matter what? Do not choose this as your answer. Here are your choices. Phrases such as, don't worry, tomorrow is another day, everything will work itself out, I think you should, he or she is an excellent surgeon, don't you think? Which are answer choices that you should never in your life of test taking ever choose as a correct answer, as something to say to a patient? Are you guys doing on the live? All of the above. All of the above. Let's talk about it. So the first one, don't worry. You never tell a patient don't worry. First of all, it's like a cliche where you say don't worry. That's number one, and we never use cliches in nursing. And number two, it's kind of like giving advice. You're telling a patient not to worry, and we never give advice in nursing. So you never tell a patient don't worry. And number three, when you say don't worry, you're dismissing their concerns. And that's something else we never do in nursing. We don't ever dismiss a patient's concerns. We always have to address it. Next, tomorrow is another day. That is a cliche. That doesn't help the patient. And if the patient's trying to tell you that they're concerned or they're scared or they're fearful about something, and you say, oh, tomorrow's another day, you just shut them down. You think they're going to want to keep expressing themselves? No. Next, everything works itself out. Same thing as tomorrow's another day. Absolutely not. Next, I think you should. We don't ever give advice in nursing. I'm going to tell you the first hint to let you know this was a wrong answer choice. It started with I. Nursing is never about you. It's about your patient. Your focus should always be on the patient, not yourself. So your response is never going to be I or mine. So if they're upset about their kids acting up and you're trying to comfort them, you never say to them, oh, my kids did that when they were young, because now you're shifting the focus on you. It's always about the patient. So you never say that. Next, he or she is an excellent surgeon. Wow, only 14 of you guys chose that. Let me tell you what you're doing when you do that. You're defending the healthcare provider or whoever it is that the patient's concerned about. The minute you do that, you just showed your patient that you're not their advocate, and you're supposed to be their advocate at all times. You think they're going to be comfortable expressing their concerns about a healthcare provider if you're defending them? Absolutely not. You listen to their concerns. And last, don't you think? First of all, that's a closed-ended question. And second of all, that is making the patient or having them feel like they have to defend themselves. So all of these are bad. They should never be coming out of your mouth as a nurse. Another select all that applies. Which concepts are most next generation NCLEX test questions comprised of? All right. And then there's a picture of Pearson VUE. Here are your choices: priority and delegation, dosage calculation, ABCs, that's airway, breathing, circulation, Maslow's hierarchy of needs, medical surgical nursing, mental health nursing. The select all that applies. So you have more than one answer. Which concepts are most of these next generation NCLEX test questions comprised of? Do you guys know? And the reason, guys, it's important for you to know this, at the end of the day, most of those questions boil down to these concepts that we're about to talk about. So even if you don't know that particular medication or that particular diagnosis or even that particular diagnostic test, if you have a strong understanding of these concepts, most likely you'll still get the answer right. What are they? Okay, the correct answer: priority delegation, airway, breathing, circulation, and Maslow's hierarchy of needs. Whether it's a psych question, it's a peds question, it's a maternity question, it's a med surg question, usually it comes down to these three. Well, except for dosage calculation, because dosage calculation is just dosage calculations. It's just the math. You got to do the math. However, everything else usually boils down to priority: which patient is most important to assess or address first; delegation: which patient would you give to which worker, such as a PN, VN, UAP; airway, breathing, circulation; and Maslow's hierarchy of needs. If you can understand those three concepts, guys, you're not going to know everything, but if you can understand those three concepts, it'll most likely lead you to the answer most of the time if you don't know what the answer is. Select all that applies. I'm killing you guys with select all that applies today. All right. Which are keywords in the question that would indicate an assessment should be performed? What are the keywords when you see that in a question that lets you know, okay, I have to assess? Here are your choices: determine, identify, monitor, check, observe, teach. Which are keywords to let you know your answer is going to be an assessment type of answer? Everything except for teach. Let's talk about this. What is an assessment? An assessment is anything that you do to get information on your patient. And that includes a physical assessment when you're actually assessing your patient. You're looking at them, you're taking vital signs, right? It could be a physical assessment. It could be an interview, asking questions, asking the patient questions, asking the caregiver questions, going into the patient's chart and looking to see what meds they're on or their patient history. Anything that you do to get information, that is considered an assessment. So key words in the question that will kind of clue you in to let you know your answer needs to be an assessment are words such as determine, identify, monitor, check, observe, but not teach. And I'm happy only 2 people chose teach. Teaching is what? A nursing intervention. When you're teaching, you're doing something for your patients, an action. So that's a nursing intervention. It's not an assessment. Again, an assessment is anything that you do to get information on your patient. All right. If you notice that your patient's having trouble breathing, what should be your first nursing action? Is it to give them oxygen? Is it to elevate the head of the bed? Is it to encourage them to cough and breathe deep? Is it to call the healthcare provider? You walk into your patient's room, you see they're having trouble breathing. What should your first nursing action be? That's right. Elevate the head of the bed. Because elevating the head of the bed immediately should help the patient breathe better, because what happens is when you're lying down, you have your abdominal girth pressing up against your lungs. You have your diaphragm that's sitting below your lungs because of gravity. It's not pulling down so that the lungs can expand, right? So it's harder for the patient to breathe. The minute you sit them up, the diaphragm should be able to pull down so the lungs can expand, and all the abdominal girth that was pushing up against your lungs is less pressure. Okay, that's number one. Number two, remember, oxygen's a medication. So I'm not saying you're not going to give oxygen, but you have to have an order for oxygen. That's number one. And number two, that's not going to be your first action. Because imagine, even if you had an order for oxygen, if that patient's lying down and their abdominal girth, all that pressure is up against the lungs, the diaphragm's not pulling down, and you put that oxygen on their face, where's the oxygen gonna go? Right? So it only makes sense to have that patient sit up first, then you give them oxygen. Something else I'm going to talk to you about. I'm happy nobody chose encourage them to cough and deep breathe and call the healthcare provider. Guys, let me talk to you about calling the healthcare provider. I'm not saying that's never the answer, because very often that's the answer. You got to call the healthcare provider for different things. But before you ever choose the answer of calling the healthcare provider, thank you. I see all the hearts on the live. Thank you, guys. Um, look at your other choices and say to yourself, can I do any of these for my patient before I call the healthcare provider? Because guess what? When you call the healthcare provider, you have to have something to say. You better have a set of vitals or some type of assessment to tell the healthcare provider, because what are you going to say to them when you call? Right? So be very careful about that answer of calling the healthcare provider. Choose that only if there's nothing else that you can do for your patient. There are going to be those type of situations. So for example, if your patient has a ruptured organ, right? There's nothing else you can do for that patient. There is no repositioning. There's no oxygen. There's nothing you can do for that patient except get them into the operating room for surgery, or they're going to die. So yes, the only option is to call the healthcare provider, right? So there are certain situations, but all I'm saying is before you choose that as your answer, look at your other choices and see, can I do any of these other things for my patient before I call the healthcare provider? Select all that applies. All right. In which diagnoses should pain always be considered as a priority to address? We know pain normally doesn't fall under physiological needs, right? What's physiologically keeping your patient alive. But there are some conditions that you have to treat pain the same way you would treat those other things that fall under physiological integrity, such as, fluid and electrolytes, nutrition, airway, breathing, circulation, vital signs, glucose. You know what falls under that. So there's certain situations where pain should be in that same bracket. What are they? Here are your choices: cancer, gunshot wounds, stones, burns, sickle cell crisis, myocardial infarction. Select all that apply. Everything except gunshot wound. The 5 diagnoses that pain should be in the same category of physiological needs is patients who have cancer, who are getting chemo, radiation, patients with stones, and it doesn't matter. It doesn't matter what kind of stones. It could be kidney stones, gallbladder stones, calcium stones, struvite stones. If there's stones, that pain is so severe, it can alter that patient's physiological status. Okay. Sickle cell crisis, burns, and myocardial infarction. You better give that patient morphine. All right. Those 5 diagnoses, pain should be considered under everything that falls under physiological needs. Select all that applies. All right, which are keywords that indicates the need to prioritize? When you see these words, you know you have to prioritize. Here are your choices: best, immediate, next, initial, ascertain, observe. There's more than one answer. All right, everything except for ascertain or observe. Let's talk about it. When you have to prioritize your patients, what you're doing is saying which patient is most critical. That's really what you're doing. Which one is most critical? Which one is most likely to die on me the fastest? That's who I got to go to. Which condition is most critical, right? That's what I have to address first. So when you see phrases such as best, so when you're prioritizing, you're doing what? You're putting things in order from most important to least. So just think about that. Words such as best, immediate, we got to do this now. Next, what is the next thing you're going to do before anything else? Initial, what are you going to do first? Those are words to let you know that whatever answer you choose, it needs to be an answer where you're prioritizing. But you see these last two, ascertain and observe, what are those? Those are assessment. When you see the word ascertain or you see the word observe in your question, it lets you know that your answer needs to be some type of assessment. Okay? Guys, use these test taking strategies because you're not going to always know the answer. But guess what? Even if you don't know the answer, there are clues. Use those clues to point you to the right direction. Select all that apply. Which phrases means you need to choose the wrong answer choice. So which phrases would let you know that this is the wrong answer choice? Which phrases mean you need to choose the wrong answer choice? So in the question, what will they say to you in the question that lets you know you're looking for the wrong answer choice instead of the right answer choice? Here are your options. Patient needs clarification. They need further teaching. Which one would you question? Which one needs follow-up? Assessment, monitoring. So which words or phrases in the question would let you know, well, wow, I'm usually looking for the right answer choice, but in this question, I'm looking for the wrong answer choice. What do you think? Everything except for the last two. So when you get a question asking you which one needs clarification, when you need clarification, that means you're not sure about something. Something doesn't make sense. So you need to ask questions, right? So for example, if you were ordered to give a patient digoxin and you look at the heart rate and you see that that heart rate is 55, and the healthcare provider knows the heart rate's 55 and they say they still need you to give digoxin, are you going to give it blindly? No, you're going to ask for clarification, because you know at a heart rate of 55, who's going to give that digoxin? Not me, because I want to keep my license. We know that digoxin makes the heart rate slow down, and normal 60 to 100. So if it's already lower than normal, why would we give that, right? Another one, further teaching. Whenever somebody needs further teaching, that means they said something crazy. They said something that is wrong, that you have to provide further teaching. Questioning. If the healthcare provider orders something that makes no sense, you're going to question it. So for example, you have to give the healthcare provider wants you to give an opioid. Patient doesn't have any pain and respirations are already decreased. They're less than 12. Are you going to give that opioid? No, you're going to question that order, because that order makes no sense and you're not trying to lose your license. Follow-up, which requires follow-up. If the healthcare provider orders something that makes no sense, or the patient says something that makes no sense, you're going to follow up on that. You're not just going to document or go ahead and do the nursing intervention as normal. You're going to follow up, because you need what? More information, because it made no sense what just happened. So all of those words or phrases let you know you're going to look for the wrong answer choices. Assessment, monitoring, those are nursing actions. Assessing is a nursing action. Monitoring is a type of assessment, all right? Which lab value is most critical if out of the normal therapeutic range? Which one would you be most concerned about if it was out of the normal therapeutic range? And your choices are sodium, potassium, WBCs, which are white blood cells, and lithium level. Which one would you be most concerned about if it was outside of its normal therapeutic range? Very good. Potassium. All of these should be of concern, but remember, nursing is all about prioritizing. Of most concern would be potassium. Why? Potassium has a very narrow therapeutic range, 3.5 to 5. Anything outside of that, the patient can have cardiac dysrhythmias. Can you live without a heart? Absolutely not, right? That is our priority. Now, sodium, normal sodium range, 135 to 145. WBC, normal WBC range. What's the normal WBC? 5,000 to 10,000. Lithium, normal lithium, that's something we give for patients like with bipolar. Normal lithium range is 0.6 to 1.2. Once that patient hits 1.4, they're in lithium toxicity. So yes, we're going to be concerned about all the others if they're outside of the normal therapeutic range. However, the most critical lab value by far is going to be your potassium. Again, normal therapeutic range, 3.5 to 5. Anything outside of that, we're concerned about the patient having cardiac dysrhythmias. All right, antacids should never be taken with any other medications or drugs. Is this true or false? True. Never, ever, 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 ever give antacids with other medication. It has to be taken by itself. And the reason for that, antacids will decrease absorption of the other drug. Okay. That's something important to know about antacids. And another rule of thumb with Antacids, you need to know the action, it neutralizes the acidity. Okay. All right, put in order. Prioritize patient's needs from first to last. What is most important down to least important. So this is a drag and drop. Take your mouse, and I need you to prioritize the patient's needs. This is Maslow's hierarchy of needs. And this is what you need to be thinking about when you get these priority questions. What are you going to do next? What are you going to do first? What is the best option? What you're really doing, what they're really asking you to do is prioritize. What is most important? Oh, by the way, this is our last question. We're down to our last question. Very good, McCrae. Well, I'm happy 11 of you guys got it. And a lot of you guys didn't even participate. You have to at least try. So first is airway, because who cares about anything else if our patient's not breathing? If our patient's not breathing, there's nothing else to protect, right? So airway first. We need our patient breathing. After our patient's breathing, then we need those vital signs because we need our patient alive, right? So we need to have a blood pressure. We need to have pulse. We need to have respirations, right? After vital signs, and this is where as students you guys get tricked up. Let me clarify this now. Fluid and electrolytes comes before nutrition. Fluid and electrolytes comes before food. Why? You can only live a few days without fluid and electrolytes, but you can go weeks without food. Therefore, fluid and electrolytes is going to be a priority. And here's another way to remember it. I just told you that potassium is a priority, right? Potassium is an electrolyte. So if you don't have enough fluid and electrolytes, your potassium is going to be off, which causes cardiac dysrhythmias. Can you live without a heart? Absolutely not, right? So fluid and electrolytes is going to come before nutrition. You need to remember this, especially when you get test questions about patient that comes on the psych unit and they're anorexic, or they have bipolar disorder and they're in the manic phase, or there's some type of disorder that would cause the patient not to eat or drink or both. Okay. And so that is it for this Kahoot. I hope you guys learned a lot of test taking strategies. Let's see how you all did.